What is trauma? Trauma is when we experience or witness a very stressful, frightening, or distressing event, or a series of events that are difficult to cope with or are out of our control. It could be one incident or an ongoing event that can happen over a long period of time. This could be anything from abuse, violence, or natural disasters to personal losses, accidents, or severe stress. Trauma can affect a person's mental health and well-being, leading to conditions like post-traumatic stress disorder or PTSD, complex PTSD, anxiety, depression, or difficulties in relationship and daily functioning. People may respond to trauma in various ways, and it can affect them long after the event has passed. Symptoms like flashbacks, nightmares, heightened anxiety, emotional numbness, or difficulty trusting others are symptoms frequently associated with trauma. How common is trauma and who can it affect? Psychological trauma can affect anyone. The impact of trauma, however, is a very individual experience, and different people may experience and cope with trauma in various ways. Some groups are more likely to experience trauma than others and experience it more often, such as people of color, survivors of domestic abuse, people who've served or who are serving in the military, people who are in prison or have been in prison in the past, refugees and asylum seekers, LGBTQA population, people experiencing poverty and social economic adversities. Trauma can be categorized in several ways based on the nature of the experience and how it affects people. Type 1 or acute trauma is a trauma that results from single isolated event such as a car accident, a natural disaster, or a sudden loss. Type 2 trauma, often called as chronic trauma, involves repeated or prolonged exposure to stressful events such as ongoing domestic violence, abuse, or living in a war zone. Complex trauma arises from exposure to multiple traumatic events, often of an invasive, interpersonal nature. This type of trauma can have profound effects on a person's development and well-being. There are a range of therapies known to be effective for treating different types of trauma. Trauma-focused cognitive behavior therapy, or TFCBT, is a form of CBT that's adapted to address and process trauma by helping individuals reframe their negative thoughts and develop healthier coping mechanisms. Eye movement desensitization and reprocessing, often called as EMDR, is specifically designed to alleviate the distress associated with traumatic memories. It involves the patient recalling traumatic events while the therapist guides them through specific eye movements. There are certain specialized treatment approaches such as phase-based intervention and dialectical behavior therapy, or DBT, which are particularly useful for individuals with symptoms of complex trauma. DBT helps manage intense emotions and improves relationships, and also reduces self-destructive behaviors often associated with complex and chronic trauma symptoms.